Hi, welcome to Breathe Better with Elizabeth. I'm Elizabeth. Today is going to be a video that's going to kick off a series of videos. So I will be releasing one video a week, and it's going to be progressing through pulmonary rehab. So the very first one, which I'm doing today, is going to basically be about breathing exercises, learning how to just control your breathing, and learning the proper way to breathe. So this video, you will want to try to start doing this every day if you can, okay? That's because it's going to create muscle memory, which you're gonna need when you have to use these breathing techniques when you're short of breath. So this is very important. This is gonna be week 1, and like I said, you can do it every day. And I actually recommend that you do it every day. Now, if you miss some days, that's okay too, because this is the big thing. You're doing this at home, nobody can see you. You could literally do this once a week if you wanted to. To get the most benefit from it, you would do it every day, but totally up to you. So the very first thing we're going to go over is the basics of all pulmonary rehab, and that is learning how to breathe correctly. A lot of people do not breathe correctly. And I didn't realize this until I started doing this as a profession, and then I go to talk to people, and there are so many people that do not breathe correctly and they don't even know it. So we're gonna do a little test first. So what you're gonna do is put a hand on your chest and a hand on your stomach, and then close your eyes. Once your eyes are closed, I want you to start breathing nice and easy, in through your nose and out through your mouth. Just steady. Focusing on nothing but your breath. Now, I want you to start paying attention as the air goes in and out. Pay attention to what hand moves the most. Okay, now open your eyes. If the hand on your stomach moved the most, congratulations, more than likely you are breathing correctly. If the hand on your chest moved the most, then you are not breathing correctly. So it's kind of hard to really grasp unless you kind of have to picture the air going in. So I'll kind of show you. But what a lot of people do, especially people who suffer from breathlessness, what a lot of people do is when they breathe, you think you're gonna go, and that's gonna get you the most breath. But you know, your lungs are from here to here. Now, if you go like this and you go up, you're not lengthening this at all, okay? If anything, you're constricting how much air you're getting in because you're pulling your stomach up into your chest, okay? So the key is to breathe with your stomach and not breathe from up here. This takes lots and lots of practice. So very few people do it naturally, especially if you suffer from breathlessness, and that's just because your body gets used to breathing that way just from so many times of being short of breath, and your body is doing everything it can to get the air in. But the problem is that that actually creates more problems when you breathe like that, which I'll go over that later on in this video. So if you're not doing it correctly, I'm going to tell you how to practice, okay? So you can practice in a mirror, or you can put 2 hands on your stomach with your fingers touching. And when you inhale, you want your stomach to go out, okay? So you're going to inhale, belly out, and then exhale. So a lot of people will do this backwards. So a lot of people, like I said, are going to inhale, sucking their stomach in, and then exhale. The problem, like I said, is when you inhale and pull your stomach in, you're lessening the area that your lungs have to open. If you push your stomach out when you breathe in, your lungs can open up bigger, okay? So this is going to improve airflow, and it will also improve oxygenation. And it does that by a couple of different things. When you breathe solely from your stomach, the only muscle that you're really contracting here is your diaphragm, okay? And it sits right underneath your lungs. When you breathe out, your diaphragm goes down, and then it'll come up to normal place when you exhale. If you're breathing the other way, you're moving a lot of muscles. So just from simply using just your diaphragm rather than all of your pectoral muscles, your shoulder muscles, you're going to have more oxygen in your blood. And the reason is that the more muscles you use, the more oxygen you're gonna use. So this is why this is so important. In all honesty, this is probably the most important thing that you can do to breathe better, is make sure that you are breathing with your diaphragm, that when you inhale, your stomach is going out, and when you exhale, it's going in. This takes some people weeks to master. So please don't give up if you're having trouble with it, okay? So the first thing that we're gonna do is just start off with the diaphragmatic breathing. Now, all of the breathing that we're gonna do from here on out, we want to be the diaphragmatic breathing, okay? So the only thing we'll do at the end of this, on an exhalation, you're gonna purse your lips together during this exercise. That's going to create a back pressure in your lungs. It's gonna keep your airways open a little bit longer so you can get more oxygen in your blood, and then you can also get more carbon dioxide out of your blood, okay? So you wanna make sure you're using your diaphragm. Put your hands on your belly. When you inhale, these fingers should come apart, okay? So you're gonna inhale through your nose and then exhale, and they'll go back together. So we're gonna do 5 good breaths, okay? Inhale and exhale. Inhale and exhale. 2 more, inhale and exhale. Inhale and exhale. Very good. So just those 5 breaths, you can probably tell you're a little more relaxed. Breathing in through your nose is very important because your nose acts as a filter. So it's actually going to trap stuff that might cause your airways to react. So you always want to breathe through your nose. It also moistens and warms the air that you're breathing in, and your lungs like to be that warm, moist environment, okay? And I know that sounds weird, but if you breathe through your mouth, your lungs, there are certain people whose lungs react to that, and your lungs don't like it. So in through your nose, out through your mouth, and then you have the fact that you need to be using your belly to breathe. Now we're going to go on to a couple more range of motion exercises that incorporate breathing exercises. So what you're gonna do is you're going to inhale through your nose as your hands go out to a T. Inhale, push that stomach out, and then exhale. Just straight back down. Inhale and exhale. Inhale and exhale. Inhale and exhale. One more. Inhale and exhale. Now we're going to do some simple shoulder rolls. When you have any kind of breathing problem, because of the series of shortness of breath that you have going on, your muscles become tight in your chest area. And a lot of people are you don't even realize it, but you're just kind of stiff. So the more you can stretch these muscles, the more room that your lungs have to expand. So we're gonna do some shoulder rolls just to open up your lungs a little bit. So we'll do 5 forward and 5 backward. Okay, good. Now we're gonna do just a gentle twist. This is more of a stretch, but you're gonna inhale through your nose, pushing your stomach out. And then you're gonna exhale as you go to one side. Inhale Inhale as you come back. And exhale to the other side. Inhale back. And exhale. Inhale back to center. Good. Now, the last one that we're going to do is going to be more of a strengthening of your abdomen and your diaphragm. Your hands are going to go on your waist. You want to make sure your feet are flat on the floor. And what you're going to do is move your torso as you breathe, okay? So you'll start off straight. You want to inhale, pushing your stomach out, and then exhale on the way back. Inhale, stomach out. Exhale, pull your stomach in. Inhale. Now change directions. One more. Good. Now sit up nice and tall. Just one last breathing exercises. You're going to start off with your hands down by your side. I want you to inhale through your nose, pushing your stomach out, and then exhale. Inhale through your nose, and exhale. And one more. So there you have it. You want to practice the diaphragmatic breathing numerous times a day, okay? You want to build strength in your diaphragm and create that muscle memory, because whenever you go to get short of breath, I want your brain to automatically start using that way of breathing. So you have to do it a whole lot to create the muscle memory, okay? If you have any questions at all, just post them under the video. Make sure that you subscribe. That way you'll get notified when more videos come out. And just share the videos if you like it. Thanks so much. Bye.